Hello, I'm Katrina Crowley from JazzyKat. As COVID-19 has affected many of our families and questions have been raised regarding the current vaccinations, we reached out to two of our doctors, Doctors Preston and Tendai Thomas, to help us understand and educate our community on this critical issue. The doctors are familiar to us as partners in our Run with the Doctors program. This video is worth your time and attention. As we fight together against COVID-19 and its spread, remember to do your part. Mask up, socially distance, wash your hands, and remember to support those who are susceptible and vulnerable to this deadly virus. Thank you.
Hello, we are here to talk about the COVID-19 disease, pandemic, and also about the vaccination process with you. Just to introduce myself, my name is Tendai Thomas, and I am a local internist here in southeastern Michigan.
My name is Preston Thomas. I'm also a physician. I'm a family practice physician in southeastern Michigan, and I'll be speaking on the two immunizations that are currently used for emergency use.
So just to start off, we'll go ahead and just do kind of a brief background in regards to COVID-19. So just a couple quick facts, and many of you may know some of these already. So COVID-19 is a disease that's been caused by the severe acute respiratory syndrome, also known as the coronavirus. And it was first identified in China back in December of 2019. As far as when it was first confirmed here in the United States, that was actually in Washington, and that was in January of 2020. At this point, we now have greater than 20 million confirmed cases in the United States alone, and greater than 400,000 deaths in the United States. So, as far as spread of COVID-19, we know that the incubation period can be from 1 to 14 days, or up to 2 weeks. The transmission is typically human to human via respiratory droplets. And as we all know, it's highly contagious. At this point in time, here we are in January of 2021, and we know that there are actually different strains, even more contagious strains, that have been identified. There can be a large variation of symptoms. So, some folks will be asymptomatic, and then other folks will be extremely sick, obviously even at risk for death. And we also know that there are some long haulers. So in other words, even though you may not necessarily die from the disease, you can present with prolonged symptoms. So I myself have a lot of patients that have complained of ongoing fatigue, shortness of breath, headache, muscle aches, and unfortunately just continue to have symptoms for, if not several weeks, even months to come. I wanted to talk a little bit about COVID-19 and the racial disparities that we have noticed. So as African American physicians, we have found it very worrisome that COVID-19 is found disproportionately among people of color. African Americans, our Latina communities have also suffered from COVID-19 as well. And so I don't know if you're going to be able to see this slide, but I do have some specific comparisons that I'd like to discuss. So when you compare COVID-19 among people of color compared to our Caucasian counterparts, you'll actually see that the cases, the hospitalizations, and the deaths are significantly higher among many individuals or communities of color, specifically our American Indian and our non-Hispanic populations, African Americans, and our Latina populations as well. here in Michigan, I would like to talk a little bit about the disparities here specifically. So in Michigan, 14% of our population is African American. But when you actually look at our COVID-19 cases, 33% are actually among African Americans, and 40% of our COVID-19 deaths are among African Americans. So large disparities here, which is extremely concerning. And we want to figure out not only why, but what we can do to decrease this disparity gap. So there are probably several reasons for this. One is just the lack of healthcare resources and access. So for individuals with a low socioeconomic status, it may be difficult for them to find providers, for them to find specific clinics that they can access for testing, for treatment, and adequate care. Structural racism, unfortunately, continues to be a problem as well. I've heard of many cases where minorities have been presenting to emergency rooms or even to specific providers and have not had the type of care that they should receive, specifically just because of the color of their skin. We also know that communities of color have large portions of individuals that work essentially, so we call them essential workers. They're right on the front line, and unfortunately this is putting them at high risk of COVID-19 exposure, infection, and disease as well. And then health conditions are quite disproportionately affecting our communities. So when you think about diseases that put you at higher risk for complications in regards to COVID-19, such as hypertension, diabetes, morbid obesity, those diseases unfortunately afflict our communities at higher rates. So the reason why I wanted to lay all this background information is because it really gives us a specific cause for vaccination. It really tells us that vaccination among our people is very, very important. Our goal is really to develop widespread immunity. So the goal is herd immunity, which Preston will speak on in a little bit more detail. But we would like 60 to 80% of the population really across the world to have immunity by way of vaccination or exposure to COVID-19. This, as we know, will prevent death, it will prevent severe illness, and obviously it will prevent prolonged complications related to COVID-19. Just as I mentioned, even for folks who don't necessarily die of the disease, we can prevent those long hauler type symptoms, which unfortunately affect function significantly. And so once again, this is even more crucial, or even especially important among our communities of color, because there is that increased risk of infection and related severe illness.
Currently, there are 2 vaccines that are being used in the United States to help fight the COVID infection. One is the Moderna and the other is the Pfizer vaccine. They're pretty similar in how they work. They're both made from what we call an mRNA for the protein binding region of the vaccine. They're both given in 2 doses. The Moderna vaccine is given every 28-day interval, and the Pfizer vaccine is given in a 21-day interval. The Pfizer and Moderna vaccine are pretty much similar in how they're made. They're both a synthetic messenger RNA, like I said before, and they're both stored in a fatty material which does not contain any fetal material, which can debunk some of the myths that are out there. And it does not incorporate into your own DNA and cause any problems, and it does not cause the COVID infection in itself. There's no way that the mRNA can turn into the COVID infection, so we must debunk that myth right now. The 2 differences between the vaccines is, one, the Moderna vaccine can be stored in a regular freezer, whereas the Pfizer vaccine must be stored at a very, very low temperature. Those are pretty much the only differences between the 2. The Pfizer vaccine has been shown to be effective approximately 95%, and the Moderna vaccine has been shown to be about 94% effective. So they're pretty equivalent as far as their efficacy is concerned. Getting the vaccine will make you 20 times less likely to get the COVID infection than not getting the vaccine at all. For severe cases of COVID, the Pfizer vaccine has been shown to decrease the cases of severe infection, but the Moderna has a better protection against the severe cases of COVID. In the studies, there has been no cases of severe infection in the Moderna, and there was one case of severe infection in the Pfizer trial. So therefore, there really isn't any difference, but the Moderna one didn't have any infection, so they say that it's a bit more effective against severe cases, but the jury is still out on that. Asymptomatic transmission. The Moderna vaccine has been shown to decrease asymptomatic transmission as well as infection, but there's still preliminary data that's still out there, and there's no definite answer as to if it can prevent asymptomatic transmission. We're still under the assumption that it can, and if that be the case with Moderna, then we would assume the same would be with the Pfizer vaccine. And some of the most common side effects of giving the vaccination is pain at the site of the injection, and that goes for any immunization that you may receive, whether it's for COVID, whether it's for influenza, pneumonia, any vaccine, pain at the site of the injection. For the COVID vaccinations, some of the other common side effects were fatigue, headache, muscle pains, and joint pains after receiving the vaccination, but those were transient, meaning that they only lasted for a short period and they resolved on their own. And one topic that we want to talk about is Bell's palsy. That's been getting a lot of press as of lately. Some people in the trials had developed Bell's palsy after getting the vaccination, but we want to let you know that Bell's palsy is not a consequence of getting the vaccination. Bell's palsy is caused by a virus that is already in your system that's laying dormant and can be activated by many different stressors in your life, whether it's stress in itself or even getting the vaccination. But the vaccination does not cause the Bell's palsy, and there's no risk of developing Bell's palsy because of the vaccination. That's something that's already in your system, so we can debunk that myth as well, that the vaccine causes Bell's palsy. So, in summary, which one should you get? Well, as far as the vaccinations are concerned, there really isn't any differences. There's more similarities than there are differences. The only difference is the way that the vaccines are stored. The Moderna can be stored in a regular freezer. The Pfizer has to be stored at a very, very low temperature. The Moderna vaccine has not been tested in ages 18 and under, whereas the Pfizer vaccine has been tested in age 16 and above. So other than that, there really isn't any differences. The key point to take home is get the vaccination in order to help mitigate the spread of the virus, and hopefully we continue to social distance and continue hand sanitation, and we'll get through this as soon as possible.